Hujambo Espresso Talk Today community, and Aquaba to the Espresso Talk Today show. Welcome to Espresso Talk Today. I'm Amma Robin, host of this great and groundbreaking podcast show where we get curious and we get courageous about any and all issues affecting Black people. The Espresso Talk Today podcast show is a Black empowerment show. We aim to empower ourselves and each other in every single show. The team discusses lots of issues and events focusing on the Black experience. Some of the issues are really obvious, some less so, but they're all important to Black people and to the Black community. Black empowerment never waits, so let's get started. As I think that, I also realize racism never waits. Racism never sleeps, it never stops, it never takes a break. Today, racism is affecting Black mothers and their babies. This is a difficult topic, and we will need all the courage that we can get to discuss this epidemic of Black maternal death, the victims, and how we can stop this epidemic. I want to begin by saying that this topic is very difficult to discuss. I recognize that. It may trigger difficult emotions, especially if you have experienced this type of trauma or you know someone who has experienced it too. Please know that I'm aiming to approach this topic with caution and respect. I also feel that it's important to confront this problem because I want people to know about this risk to Black women's lives and to the lives of their unborn children. Please also know that it's okay to step away from this uncommon discussion and practice self-care. You are not alone. You matter. The show begins now, and it begins with the story of Tori Bowie. Tori Bowie was born in 1990 in Sand Hill, Mississippi. Tori was an accomplished American track and field athlete. She gained international recognition as a sprinter, specializing in the short sprints, including the 100-meter and 200-meter events. Those actually are some of my favorites. Tori was a 3-time Olympic medalist and 2-time world champion. Tragically, though, on May 2nd, 2023, Tori Bowie passed away due to complications related to childbirth. Tori Bowie was a Black woman in America, and she died in childbirth. Officials determined that she died from complications of childbirth due to respiratory distress and eclampsia. Tori's baby girl also died. And sadly, even more sadly too, Tori's tragic death is not the only one. And this is the topic of today's show. Black women have a 53% increased risk of dying in the hospital during childbirth, no matter their income level, the type of insurance, or other social determinants of health. This suggests that systemic racism seriously impacts maternal health. And this is according to an 11-year analysis of more than 9 million deliveries in U.S. hospitals, and this was presented at the anesthesiologist's 2022 annual meeting. Tori's untimely death serves as a devastating reminder of the systemic issues and medical racism faced by Black women, even those who are high-profile figures. No one is immune. Dr. King once said, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." Racism in healthcare is also shocking and inhumane. This podcast show has discussed medical racism with experts, and it was even more shocking and inhumane than even I imagined. And Black women are often the victims or targets of racism in the healthcare system and by medical personnel, doctors and nurses and others who work directly with patients themselves. Yes, doctors and nurses are often on the front lines of care and have shown racism and bias in all forms of their interactions with patients, including adults and children. I said no one is immune. We'll get to that one in a minute. Racism, medical racism, is an insidious form of discrimination that has disproportionately affected Black women. The alarming statistics that I just quoted surrounding Black maternal deaths highlight the urgent need for change, real change. Tori Bowie's recent passing reminds us of the painful reality that many Black women face while seeking medical care, particularly maternal care. According to the Centers for Disease Control and Prevention, Black women in the United States are 4 times more likely to die from pregnancy-related causes than their white counterparts. This shocking disparity demands our attention and our immediate action. Going back to Tori Bowie, she was an Olympic athlete. She was world famous. She was a world champion. But this did not prevent her from becoming another victim of medical racism. Despite her success and prominence, she faced a healthcare system that failed to provide her with the quality and equitable care and treatment that she deserved, and that her baby deserved. Tori's story is not an isolated incident. Many Black women have shared similar experiences where their concerns were dismissed, symptoms were ignored, their treatment was delayed. It's essential to acknowledge these stories, to amplify these voices, and demand justice for the lives lost. To understand the mistreatment of Black women by the Medical Association, we have to acknowledge the historical context of slavery in America. During the era of slavery, Black women were subjected to seriously inhumane conditions and treated as property rather than as human beings. Slavery was not only a system of labor exploitation, but also a breeding ground for medical experimentation and abuse. Enslaved Black women were often subjected to medical procedures without their consent, remember that wasn't needed, or their consideration for their well-being. Again, that wasn't needed. These practices laid the foundation for the systemic mistreatment of Black women in the medical field today. It also laid the foundation for how some doctors view and treat their Black female patients today. I want to emphasize that yes, the healthcare system is unjust and racist, but it goes deeper than that. It goes farther. Doctors and nurses can carry unconscious bias, at best, against Black women. At worst, they can be outright racist. Both of these seriously affect how they view and treat their Black female patients. Both of these affect patient health outcomes. The healthcare system is beginning, particularly since COVID, to see that it has some racially motivated problems when it comes to treating their patients of color. But the system is reluctant to admit that doctors in every field, every specialty, nurses, medical admissions personnel, orderlies, ER staff, first responders, and paramedics can also hold racial biases. And that this shocking and inhumane attitude, I have that in quotes, that's from Dr. King, this shocking and inhumane attitude negatively affects patient care and patient health outcomes. Yes, healthcare professionals can be racist people. They are people. They can carry their biases. And it's time to push these doctors off their pedestals and to start to see that they're just people, yes, who can be biased and racist, and we have to challenge them. But everything has a history, and history of medical racism in America began during slavery. I know what you're saying. I say that lots of problems began during slavery. I admit it, I do. I'm guilty. And that's because anti black racism in America has its roots in American slavery. It continues for other reasons too. We know hasn't been a reckoning yet, but the roots began in the period of enslavement. And remember, some of the medical history that people like Florida Governor Ron DeSantis and Texas Governor Greg Abbott, this is what they want you to forget. There was a doctor, I have in quotations, and I'm really using quotations here, James Marion Sims, who they credit as the father of gynecology. But really, he was just a slave-owning doctor who performed medical experimental surgery on enslaved women. He said that he was trying to find a cure for fistulas that resulted from childbirth. Instead, he purchased enslaved women, tied them down, cut them open while they screamed in agony. We should remember his name only for the suffering that he caused. He could have used anesthesia. He didn't because he said black women don't feel pain. Names that we should remember are Anarcha, Betsy, and Lucy. And there were many others and whose names have been lost to, the historical record. They are now known as the mothers of gynecology, Anarcha, Betsy, and Lucy. They were the women who suffered. Many of them endured dozens of surgeries without any kind of anesthesia or care from Marion Sims. These women deserve to be remembered and honored. Okay, that was my slight digression. The legacy of slavery and its roots in modern medical racism continue to reverberate through generations, resulting in disparities in healthcare access, medical treatment, discrimination, and a disregard for black women's pain and concerns. Remember, after all, the medical community never cared how Sims's patients were treated or the pain that they suffered. Many doctors still believe, and they're still being taught in medical school, that black people don't feel pain, or we have a reduced feeling of pain, that our pain threshold is much higher than a white person's pain threshold. And I have personally experienced this racist belief in action when receiving treatment, not just one time, but several times. I could tell lots of stories, but that's for another episode. In this episode, we're talking about medical racism causing black maternal death, or near deaths. I discussed Tori Bowie's tragic and inexcusable death during childbirth and the death of her child. And I'm so sorry to say that there are more deaths and life-threatening experiences due to medical racism. Let me throw out a few names. Serena Williams. In 2017, superstar Serena Williams shared her harrowing experience of childbirth complications. Despite her fame and wealth, she faced dismissive treatment from medical professionals when she recognized the symptoms of a life-threatening pulmonary embolism. Fortunately, she lived to tell the story, and fortunately, again, she's telling the story. Second, we have Kyra Johnson. In 2016, Kyra Johnson, a 39-year-old African-American woman, actually died in childbirth due to complications following a C-section. Her death was attributed to medical negligence and a lack of timely intervention. In other words, she was dismissed. Kyra's stories highlight the devastating consequence of systemic biases within the medical system. Shalon Irving was a public health researcher, and she died in 2017 after giving birth to her daughter. She fell victim to complications related to high blood pressure, which actually could have been managed with appropriate medical care. But her passing shows the urgent need for improved treatment during the postpartum period for Black women. Now, this postpartum period is considered the fourth trimester, but often Black women, once they have their babies, they're pushed out, they're dismissed. They're saying, the medical system says we're done with you. And this is what could happen. Finally, we have Amber Rose Isaac. In 2020, Amber Rose Isaac, a 26-year-old Black woman, died in childbirth due to complications related to an ectopic pregnancy. These are just a few cases. I mean, they're so sad, and just a few of the cases that we know of. And these are the cases that have received media attention because the victims were famous, or because there was a lawsuit and a settlement, or because there were protests highlighting the increased health risks to Black women during or following childbirth. These recent examples of Black women dying in childbirth serve as painful reminders that medical racism remains an urgent crisis. It is also, I would call it also, an epidemic. It is crucial to bring attention to these cases, demand accountability, and work towards systemic change. It's also important to identify the doctors, nurses, and other medical providers who are mistreating their Black patients or undertreating their patients, who are dismissing their patients. In short, we call out anyone who's acting with bias or racism, because this is unacceptable, but yet it's happening, and Black women are dying because of it. But how are racism and bias showing up? You might be asking, what are Black women patients experiencing? And I'm glad you asked, because, it doesn't always appear like we might expect. It's not a doctor or a nurse calling a woman an N-word to her face. It manifests in different ways. And here are some of the ways in which it can show up in the healthcare system and in patient treatment. Number 1, dismissal of symptoms and concerns. Wow, I've gone through that one myself. And I know lots of other Black women who have too. Black women often face dismissive attitudes from healthcare providers. Their symptoms and concerns are downplayed or ignored. This can lead to delayed or inadequate care, late diagnosis, or no diagnosis at all. Another way is stereotyping and bias. Implicit biases and stereotypes can influence healthcare providers' perceptions and, of course, their treatment decisions. As I said earlier, Black women are often perceived as being more resilient to pain, less credible, or more likely to engage in risky behaviors, resulting in substandard care or delayed interventions. People are acting on their biases, and Black women are paying for it. Here's another one. Lack of cultural competence. Healthcare providers who are not culturally competent, or who are simply just racist and biased, may not fully understand or appreciate or even care about the unique experiences, values, and beliefs of Black women. And this can lead to misunderstandings. It can lead to miscommunications, and worst of all, it can lead to the inadequate provision of care. Inadequate prenatal care. Black women may experience disparities in the access to prenatal care, receiving fewer or lower quality visits. And this can result in missed opportunities for early detection and management of complications, leading to poor maternal and infant health outcomes. Number 5, maternal mortality review disparities. That's a long string of nouns. Let me explain it. This is the process of reviewing maternal deaths to identify the contributing factors and then implement preventive measures that are influencing racial bias, or influenced by racial bias, I should say. This can result in a lack of comprehensive understanding of the underlying causes of Black maternal deaths and hinder efforts to address the issue effectively. Most of the time, Black maternal deaths are blamed on women, blamed on the mother. They're saying that, well, she didn't come to enough appointments. She missed an appointment in her 3rd trimester. Or, wow, she had high blood pressure. But often, a high blood pressure is serious, but often these things can be managed. but instead they are victim blaming. And what's happening is that nothing is changing and women are dying. Then, of course, there's implicit bias or racism in medical education. Wow, wow, wow. Starting at the educational level, bias can also rise from the education and training of healthcare professionals. And this is not addressed. Implicit biases learned during medical education can perpetuate disparities in care, and it can also lead to death. I mean, this is an investment. Bias or racism in medical education is an investment in racism and in making racism more prominent and giving it more power. So we really, really, really have to attack the medical education system. Addressing racial bias in Black maternal health care requires systemic changes within the healthcare system. And this does include comprehensive training on cultural competency and implicit bias for healthcare workers, diversifying the healthcare workforce. That's a huge one. Make it more diverse. Everyone isn't white and Western, okay? Get a diversified healthcare workforce. Ensure equitable access to high-quality prenatal care, and implement evidence-based practices that prioritize the well-being of Black women. Evidence-based practices. This really is crucial to actively engage in conversations, advocacy, and policy changes that address racial bias and promote equitable care for Black women. By raising awareness, fostering dialogue, and holding healthcare systems accountable, we can work towards eliminating racial bias and achieving better health outcomes for Black women and mothers. Well, we can hope to eliminate it, but we certainly can reduce it, we can control it, we can identify it, we can call it out, and we can take away its power. So what can we do? What can we do? I'm going to answer this from a systemic approach and then from an individual perspective, because what happens in the doctor's office is almost as important what's happening within the system itself. It's crucial to bring attention to these cases, demand accountability, and work towards systemic change. We should advocate for comprehensive maternal health care reform. We should promote implicit bias training, and we have to amplify Black women's voices, support initiatives that amplify the voices of Black women in the healthcare system, like using patient advocacy groups and community organizations. We can elevate their stories and experiences of Black women to drive change and hold medical institutions accountable. I love that word, accountability. That is so incredibly important. Also, research and data collection. We should advocate for increased research and data collection on racial disparities in maternal health. And robust data is vital for understanding the extent of the problem and developing effective solutions to it. Now, a lot of systems, like the medical system in a lot of countries, but I'll go into that later, like to say that they're colorblind. They don't want to bring in race as a determinant because it's not supposed to be, but it is. It is a factor. And if we just allow them to use colorblind data, well, and to do colorblind research, then we are not going to get the full picture of what's happening to Black women. So that is incredible. That is just so important to do. The fight against medical racism and the high rates of Black maternal deaths require this kind of collective action. And together we really can demand change and hold institutions accountable, and to ensure that every Black woman receives the dignified and equitable health care that she deserves. But we got to work together. We really, really do. When dealing, this is kind of shifting topics now, but when dealing with a medical professional, a doctor or nurse, it can be very confusing and intimidating to know what to do. It can be difficult to know if something really happened. Actually, if you think there was a racist or biased encounter, then there probably was one. And we know how this feels. It's better not to second guess yourself or even give the healthcare professional the benefit of the doubt. Your health and your baby's health depends on that. So the first thing that individually what we can do, educate yourself about the potential risks and complications that Black women face in pregnancy. Learn about pregnancy-related complications such as preeclampsia, eclampsia, gestational diabetes, hemorrhage, and blood clots. And these can lead to severe complications during pregnancy and even result in death. Also, let's learn about the postpartum complications. Higher risk, Black women, they say, have a higher risk of postpartum complications like infections, hemorrhage, and cardiovascular events, which can lead to maternal mortality. Learn about any pre-existing conditions that you may have that could affect your health during or after pregnancy. Here's one. This is, okay, I'm going to push on this. Report any and all racist behavior. Write a letter, send an email, tell someone, tell the receptionist. We should not walk away and keep this a secret anymore. Even if you decide not to send a letter or email, keep a journal of what happened, of exactly what happened, of when it happened, and the circumstances under which it happened. Keep the journal current and write everything down as soon as you can. This record may become important later. Number 3, never, ever, ever, never go to a doctor or hospital alone. Take someone with you to act as your patient advocate. Instruct that person to bring and ask questions. That person, the patient advocate, is there for you, there to speak for you, to protect you, to help you. Patient advocates or patient navigators are becoming increasingly popular. Healthcare personnel are familiar with them, although a lot of times they're going to try to keep them out of the room, but don't let them do it. And personally, I found that each time I had a racist encounter with a healthcare professional, it was when I was at the doctor alone or at the hospital alone. When I had a patient advocate with me, healthcare professionals provided better treatment. They listened to me more. Maybe they knew they were being watched, and I got better treatment. And your patient advocate doesn't have to be like a lawyer or an accountant or, a congresswoman or anything. Your patient advocate can be a relative or a friend, just anybody that you trust. Number 4, when healthcare professionals make a statement that you find questionable, code word, racist, ask them about it, challenge them on it. A nurse once told me that Black people have thicker skin. And she said this because she was having difficulty finding a vein on me to take blood. That was her problem. I have fantastic veins. No one has had problems getting blood from me. But she said, I can't do it because Black people have such thick skin. And I remember the time I thought, racist nurse here. And what I should have done was ask her, where did you hear something like that? Where did you learn that Black people have thicker skin? Then I should have told her, we actually do not. I should have challenged her thinking, and I should have actually asked for another nurse who knew how to take blood. Healthcare professionals will try to pathologize Black patients to give them an excuse for providing inadequate care or to cover their own incompetency. She couldn't find a vein, so instead of it being her problem that she needs maybe more practice, she instead blamed it on me. Okay, number 5. On my podcast show about medical racism, I had an episode. Mel asked, whom can you trust? My answer, this is controversial here, no one until they earn your trust. Medicine is a science. The practice of medicine is not always scientific, ethical, or colorblind. It is rife with bias, racism, and different treatments based on class and race and other factors that aren't important. The doctor needs to earn the patient's trust. Okay, the patient need not be confrontational, but rather to approach the doctor with a certain, maybe low level of skepticism. Ask your questions. Notice how the doctor answers your questions. You want to develop a relationship with the doctor, but trust takes time. and the doctor needs to earn that from you. Number 6, consider using a midwife or doula. I mean, that's how it was back in the days when, we couldn't go to a hospital. But midwives and doulas are becoming much more popular, and they're providing such wonderful care and such great experiences. You can find a culturally competent doula at blackdoulas.org, and you can find a great midwife at the blackmidwivesalliance.org. You don't need to write any of this down. It's all on my website. Number 7, cultivate a support network. Oh, I know we always try to go this alone and be the strong Black woman and to be the lone wolfette. We shouldn't do that. Surround yourself with supportive individuals who understand the unique challenges Black women face in healthcare. Share your experiences, seek advice, and gain strength from the collective wisdom of your community. And please always turn to the elders, okay? They know it. They really do know what they're doing. Number 8, this goes in line with the previous one. Share your stories. No more silence anymore. We have to speak out about our experiences with medical racism, share our stories on social media, write to local representatives, and engage with advocacy groups fighting against racial disparities in healthcare. By raising awareness, we can drive change, but staying silent just perpetuates the problem. Number 9, I'm almost through. I mean, all of these are on the website, so don't worry about that. If you are pregnant or know someone who is, then I really encourage you to check out this app called Earth. That's spelled IRTH. IRTH. On this app, you can find prenatal resources, birthing information, postpartum and pediatric reviews of care from other Black and brown women. This is a platform for the pregnancy and motherhood journey made by and for women of color. You search for doctors and hospital reviews from your community. Leave a review today to help inform and protect others. They also have Earth, IRTH, also has an amazing website called theearthapp.com. IRTHAPP.com. Earthapp.com. You can find a midwife, doula, lactation consultant, breastfeeding organizations, and a free download book called Birth with Earth. You see, so it's the birth without the B for bias. So Birth with Earth, a mini manual to pregnancy and childbirth for Black people. Earth is also working to end racism and bias in pregnancy and infant care. You can also share your birthing experiences on the website and app. Remember, IRTH Earth and IRTHapp.com. No need again to write this down. You can find these resources on the Espresso Talk Today website on the Habari page. Look in the Women's Health section. Well, community. I guess that is all for today. I hope that you have found this information helpful, and I understand that this could also be very difficult to hear about, Black women dying in childbirth or just after giving birth. It can also be distressing to hear that the healthcare system is not always in your corner, and that healthcare professionals can carry racial bias that affect your treatment and health outcome. But knowledge is power. There are organizations that are experienced, professional, and ready to help you to have a safe and loving pregnancy or birthing experience that you dreamed of and that you deserve. As I said earlier, if you are distressed or feeling triggered by this information, then please step away from it. Take care of yourself. Sit in silence and breathe. Share your feelings with a friend or family member, but please do not deny your feelings. They are valid. You are important and you matter. You are not alone. And let's also remember to take care of ourselves and take care of each other. Let's check on each other. Call up your sisters, ask them how they're doing. Let's listen to each other. We gotta be there for each other every day. Asante Sana to medical historian Professor Deidre Cooper Owens, who presented this history of Black women and medical racism from slavery to the present day. Unfortunately, there are a lot of common things happening from slavery that are still happening now. And fortunately, incredible professors and researchers like Professor Cooper Owens can help us to learn the history, put it in context, see that it's not our fault, and see that the problem is that white supremacy is still running the show. Asante Sana to Anarcha, Betsy, and Lucy, and the other enslaved women who are the real mothers of gynecology. You will never be forgotten, and you will always be honored. Asante Sana to you for showing up and staying with us. We appreciate you and your presence and your continued support. You really are the reason that we do what we do every single day. And you can join us every day to discuss these issues on Instagram at Ama Robin L. That's Ama, AMA _ Robin _ the letter L. Check out my profile. Leave your questions, comments, reflections, and just anything you want to say. I want to hear from you, and I am here for you. And if you think that other people would be interested in this Black Empowerment Podcast show, please send the show to them. We got to start talking about these issues, and we got to keep talking about them. Racism never stops, so neither can we. But we can also celebrate ourselves, our culture, our community, and our connection. These are more powerful. I always remember that love is greater than hate. It is more powerful than hate every day. And if you want to keep discussing or just keep reading about these issues, then you should definitely subscribe to my weekly newsletter, The Nomo Beat. We discuss lots of different issues there so you can get your weekly dose of Black empowerment. It's never a dull moment, but there are lots of growth moments. You can subscribe at the Espresso Talk Today website, espressotalktoday.com, or again on Instagram at Ama Robin L. Remember those underscores. I'm Ama Robin for Espresso Talk Today, and remember, now more than ever, strength, soul, and reparations. And #BelieveBlackPeople. Ashe, community.